It's coming up, as well as healthcare, Medicare for all. That push is gaining steam, certainly among Democrats and the progressive wing of that party that wants it for everybody. The UK government, though, is warning, be careful what you wish for. There's a new report sounding alarms about massive wait times for those in a single-payer system, and that you have to, sort of pay off people to move to the front of the line. Beverly, it's an interesting kind of a warning from across the pond. There are a lot of things that make sense. It is cheaper, less expensive on you, but there are issues like that.
There are always trade-offs. You can also look at Canada, where the wait times are often longer than even in the UK. In Canada, right, if you need hip surgery, it's going to take you up to 11 months to be able to get it. So are Americans going to be willing to make that trade-off? I don't think so. This is what you need to have Donald Trump and other Republicans talk about, the wait times. They often talk about costs, but when it comes to people getting access to health care, you need to talk about the quality of that, and I think that's the messaging point that they're often missing.
What I'm wondering about is whether Republicans are missing something that they missed in 2018, Michael, the impact on the power of talking about not necessarily Medicare for all, which I think is bad branding, but health care for all, or affordable health care for all. And they missed that and lost the House. They don't have a cogent or coherent plan themselves on this. Is that going to boomerang on them?
It might, and I think you're right, because it's a very difficult subject to talk about without talking about the government doing more.
Right.
That's the fundamental issue. And I think the president has tried, when he talks about lowering drug prices, things like that, but there hasn't been a lot of follow-through. There hasn't been a lot of effort to figure out what is the real plan that Republicans can run on that will be in keeping with a free market, deregulated presidency. And so far, we haven't really seen that.
And there's even concern within the party, right? I mean, the Democratic Party, Jack, I had, Joe Manchin of West Virginia on, who Bernie Sanders says is for the kind of things I'm talking about. He said, no, I'm not. I mean, Medicare for all sounds great, but we can't even afford Medicare for some right now. So there's a divide in the party, isn't there?
Yeah, and not surprising. And first of all, I talked about sort of the economy being a major issue for Trump, but healthcare is right there as well. That's why this is such a key issue. And when the economy's doing okay, I think it becomes a little less important in terms of maybe motivating voters. So that kind of shifts the focus to healthcare, and you look at the midterms. But you're right. I mean, the Medicare for all, I mean, we can't afford it. And I guess the question from a market standpoint is, when do these massive deficits matter? And the amount of spending that is being thrown out there to fund Medicare for all, $52 trillion,
it's just
$20 trillion additional spending. I mean, it is, the concept of trillion is just unbelievable.
I like the SNL skit where it says, we could say gazillion like a it's meaningless.
But at some point,
those are real numbers.
I think so.
All right, we're going to take a quick break here.